I've been talking about patient advocacy, but there's also some advice I'd like to give to physicians and clinicians who are seeing patients, especially women. It's pretty commonly known now that the pain that women get with heart attacks isn't always the traditional left arm and jaw and that sort of thing. My pain was directly through my chest, out my back, like I was being stuck with a saber. And the physicians at Lenox Hill did a very good job with me, but they were concerned that I may have been having an aortic dissection. And so they did respond really, really well, but found out that it was a clot and I needed a stent. And one of the things I would really commend them for was not just looking at me and saying, oh, yeah, she's having pains in her chest, she's menopausal or she's older or something. Care is not one size fits all. There is no such thing as a typical patient. And there's no such thing as a typical pain. There may be lab-supported data that you're looking at, but listen to the patient as well. Patients are changing. They're younger, more female, more educated, more computer savvy. And the thing that is really gone, which is a good thing, is patients will no longer listen to anyone who says to them, I'm the doctor. You do what I'm telling you to do. What's wrong with that statement? Well, what's wrong with that statement is that the patient needs to be educated. They need to understand what's going on. Compliance does not come just with direction. Compliance comes with understanding. And for most patients, they need to know what's in it for me. What happens if I take this med? What happens if I don't take this med? What happens if I can't afford it? Is there something else I can do? So when the patient is talking, they need to get the information they're looking for. And I know doctors are under terrible time constraints, and that is a real challenge. But you do want to make sure the patient does understand what they should be doing. One of the other things is basically discuss options. In many cases, there isn't just one way to do it. When I was first diagnosed with diabetes, I went to a doctor who said to me, do you want pills or do you want shots? I was just floored at that point because I said, I don't want either. I want to see if I can control this with my diet, with exercise. Ultimately, I lost 65 pounds. I came down from an A1C that was over 11 down to one that was just about 6. The patient knows themselves. They know what they want to do sometimes. And sometimes it has the physician's role is really to direct the patient into health. So if the patient is not immediately saying, yes, give me insulin, I'll take it. But why doesn't that seem like the right thing? Share the information, discuss the options. And also patients need to know what's going on. Sometimes they don't even understand what the disease is. Sometimes they're so almost in shock with the diagnosis that they haven't had time to really sort of digest what they're being told, which is why I often tell older patients, especially who may be afraid to talk back to their doctors, take someone with you. Let that person be a note taker. Let that person understand it for you. You listen, but another person is there. So that is another piece of advice I have for physicians. If someone brings in somebody else to sit with them, it's not in that they're not trusting you. It's that their capacity to understand what you're telling them at that moment may be a little impaired because of the shock factor. Also, you have two types of people. You have extroverts, you have introverts. Extroverts have to ask questions. They do not feel that they've thought something through unless they have talked it through. And then introverts work differently. They listen. They go off scene, they process, and then they come back to ask the questions or simply don't comply. So a lot of times doctors don't understand, I told you all of this. Why didn't you understand it? Well, the person may have been an introvert and they needed to kind of process it for themselves and form their own questions. And it wasn't that they didn't listen. It's just they process information differently than the person like myself, who's an extrovert and will ask thousands of questions. So that's some of the advice for doctors. Not always easy to do the one size doesn't fit all, but that's what's going to get your patients to really listen and comply to what you know is best for them.